Hello my friends, my family, esteemed colleagues. There was a request recently for me to make a video on dental care, mouth care. Well, of course, I'm not a dentist, but this is the plus. Because as we know by now, that the schooling system is here to mislead us. And whenever you are licensed in something, expert of something, you are so brainwashed that you are the last person that is going to notice the mistakes that you yourself will be repeating. So, what is this thing with teeth and mouth? So many problems. Every person has their teeth drilled, later on pulled, replaced. Why? Just brief observation of nature will tell us that there is not a single animal in nature that has a problem with tooth decay. None. You're not going to find caries in any wild animal. They may have broken tooth because of fighting, because of injuring themselves, but no caries. And even if the tooth is broken, it will be very rare that they are going to be in a pain for a long time. The two things are going to happen. Either the tooth is going to basically heal, it will function damaged, or it is going to, the body is going to push it out. Everybody noticed, or everybody, at least people who have a problem with teeth, they have noticed that at one point some teeth are getting loose. Why is tooth getting loose? Because if it's not being used, there is no reason for it to be there. We have to use our things, our everything. You don't use your leg, it's gonna lock in place. I have a friend now here that had a fissura of humerus on leg, and the doctors, I don't know for what reason, they put her in a cast. I said, this is a bad thing because your leg is going to freeze in place, especially ankle. So as soon as you can, within 2 weeks, you have to start putting pressure. And my friend, of course, she always asks me for advice and never, ever, ever does anything I say because it's always contrary to all the other doctors that are around her. So she was not putting any pressure, and now it's over 2 months. Now they took the cast out and the leg is unusable. Now it will take her probably 6 months of therapy before she will be able to properly use that leg. So, a little bit off topic, but tooth will, if it's damaged and they cannot be used anymore, body will kick it out. Why does that happen with us? Because we are poisoning our body so much, and we are basically preventing our body to function normally. So with us and domestic animals that we feed, the things don't happen normally as they should. As a observation again, just look at a domestic animal like dog or cat, and they have a tooth decay. Same like we do. They lose their teeth. They start getting plaque on teeth, and they start getting caries, then inflammation of the gums, then lose teeth, and they start losing their teeth. What is the reason? Obviously, it is the food. Now why? For one, no animal should ever be fed with starch, dietary glucose. Starch is sticky stuff. It sticks. And there comes your plague. Starch is being used as a glue. Mix it with water and you have glue. So, of course, you glue your teeth daily. So now we have invented brushing. You have to brush. If you don't brush, that's why you have a problem with teeth. Well, no animal brushes the teeth, and they have no problems. I've stopped brushing teeth. I brush my teeth if I want to kiss my wife. Otherwise, I don't. It's not necessary when you eat correctly. Eliminate starch, there your plague is going to go. You're not going to have plague anymore. No buildup. But of course, people are stuck so much into eating sugars and eating carbohydrates and plants. This all stuffs between the teeth, and then of course decay starts happening. But most of the decay happens because the tooth is already weakened. Why is it weakened? Again, from dietary glucose, from starch, but not from the outside, but from within. Same as destruction of a bone, osteoporosis, osteopenia is triggered from starch. The same happens with our teeth. Not only teeth, mandibula, jaw, the whole structure, bone structure. Why is this? Because again, tooth has osteoblasts and osteoclasts, same like our bones. Tooth can rebuild itself, but it cannot rebuild itself if things are missing. And the thing that is missing the most is a buffer, alkaline buffer. It's alkaline phosphatase. And why it's missing? Because of eating starches. When our liver starts flipping them into fat, because it cannot store glucose, so whatever is not being used immediately for energy is being reprocessed in a liver and turned into fat. And in the same process, a fat is being produced, uric acid is being produced. So we produce tremendous amount of uric acid. This would acidify blood, which cannot happen. Blood has to stay slightly alkaline, at least 7.3.5. So first reaction of the body to protect itself is to mobilize any alkaline buffer it has available to maintain the pH of the blood. And alkaline buffer, the highest quantity of it is in a bone, because osteoclasts are being used as acidic provider that dissolves the mineral structure of the bone, and osteoblast is being used as alkalizer with a buffer, with phosphatase. It alkalizes the area, and when minerals go there, they start sedimenting. So if you don't have buffer, you cannot alkalize area, you cannot alkalize tooth, you cannot repair it. Now we are told, no, you gotta brush, 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 brush. That's answer. This is just cosmetic baloney, nothing more. Everybody is brushing and everybody is coming with caries. What I have noticed that sweet drinks, especially the most toxic ones like Coca-Cola, they bore holes in a tooth. They actually bore. I noticed when I started drinking, as a sailor, I started drinking alcohol more and more until I became alcoholic at one point. But at one time, my favorite drink was Cuba Libre, which is basically rum with Coca-Cola. Rum with Coca-Cola, okay? Mostly rum and little Coca-Cola and lime. As soon as I start drinking this, I start getting caries all over the place, more than before. Of course, then we go to dentist and brainwash dentist, again, like we medical doctors. If you don't research, you are staying brainwashed. And what you do harm, you don't do good. So dentists are basically tooth mechanics. Sees the caries, drills it out, and patches the hole. Well, this is not healing, because my teeth have craters in them through years and years of drilling and re-drilling and re-drilling. And now the craters are too big for self-healing, but I'm basically leaving them opened because I know now the truth. So if I don't eat carbohydrates, then my gum health, and I hydrate, my gum health is great. No more decay happens, and even if the food gets stuck, there is no really decay anymore going on. And just as precaution, and because I have several crowns, and you cannot clean under the crown, so bacteria starts growing there, and smell becomes like a rat died in my mouth. So I take colloidal silver. Every evening before going to bed, I take a sip and I leave it in my mouth as long as I can, and sometimes even in the morning I do it, and I don't have problem. And this is not only that is getting rid of the bad odor, but also it is sterilizing more or less my mouth, which is helping the gums. And it's absorbed and goes and kills all the bacteria if there is any on a roof of my teeth. And then it seeps into the blood, which is great electrolyte. Now, it's very easy to take care of teeth. Again, you cannot ask your dentist about it because they know nothing of value unless they were, like myself and some other more scientifically oriented people, start researching and looking for other ways than the one that we have been told in the school. But there's very few of us to do that. Caries, you can stop with colloidal silver, but you have to use colloidal silver daily and hold it in the mouth as long as you can so it seeps in. But again, bacteria you can kill, but the porous, broken up tooth will gonna stay there because you went through enamel and now you are indenting inside, which is very porous. You can allow your body to heal it if you give it correct frequency. Now, there is one frequency that is very beneficial, and this is frequency of milk and casein. Why? Because During the time when mammals are sucking, this is the time when the growth of teeth is stimulated. It's a frequency of milk. So we can help also healing of the tooth with the same frequency, which what you can do, you can eat a fresh cheese, and what is stuck to the, or make sure that piece of cheese gets stuck on a place of caries and leave it there overnight. And day after day repeat this. It is going to be stimulating regrowth of the damaged tooth, and even the enamel is going to start growing back. Now, this is a slower process, but it happens. Now with my craters, I just know that they are getting worse, and since I'm not going back to the mechanics, tooth mechanics, I am basically being saved, not being damaged more. There is now a big push for people. If you have a problem with a tooth, well, you get root canal, but then they say, no, root canal, this is where bacteria are going to grow, and this is where they will, from here, they will then attack your mouth and your body, and this is terrible. It's not good to have root canals. It is best to pull the tooth out and then put in some stem, metal or ceramic, and make artificial tooth. Well, this is again just a spiel to make money, because this is very expensive and they're asking for tons of money, because it is pure lie when they say that root canal, because it's a hollow and good breeding ground for bacteria. Well, root canal is never left hollow. When root canal is being done, then it is filled in and blocked and makes perfect anchor. If you want to have artificial tooth put in, you can just make it right on top of that. I mean, this is how crowns are being made. But you can also put a finer stem, just screw it into the remnants of your root, where root canal is. Just screw it in there and paste. No, but that would be now cheaper way, and we can make more money if we just take everything out, more procedure. This is all baloney, okay? There's nothing, no problem. This tooth here, I was about 9 years old. I don't know exactly, but I was a young kid, just came from, I was still living at my grandma's house in Zagreb when we came from Czechoslovakia. So I was somewhere between 8 and 10 years old when I was drinking drink that they used to call kokta. Great drink in comparison to Coca-Cola. Coca-Cola is pure garbage. And I was drinking this, and one of my friends, I don't know if my cousin or somebody, banged the bottle and almost half tooth just was sliced out. And the tooth mechanic checked it out and said, look, you are still too young, you are growing. It makes no sense to put now crown on this. We are just going to build it up. And I don't know, may hold one day, may hold week, may hold months, may hold year. But we'll try to keep it that way until you get a little older, and then when it breaks off, we'll put a crown, permanent crown on it. So basically what he did, the root canal, of course, because it was exposed, and of course closed the canal, stuffed it in, and then made this buildup with artificial tooth and anchored it nicely with like fibers. He did such a good job that in a time I forgot completely that this was done. And just about 8 years ago or so, about 8 years ago, when I was, oh no, it was maybe a little more. I know what was the occasion, but dentist was checking my teeth and said, "Oh, this tooth is artificial. You had a root canal here, right?" And I said, "Pooh, I don't even remember anymore if that was, but you know, it was just coming to me when he said it. Oh, yeah, probably yes, but this is perfect. I mean, I was eating apples, I was eating corn, I was chewing, I was biting the nylon for fishing line. It was working beautifully all my life. I had 50 years there. And never got loose. So the problem of teeth being loose is always problem we are not using them. Gums start hurting, the tooth start hurting, or something is happening there. You don't use this part, you chew on the other side, and where you don't chew, this part becomes loose. Another thing that can loosen teeth is inflammatory processes. Now, why would gums get inflamed? Because they are toxic. Gum is another tissue made out of cells. And when the cells get toxic, they get acidic. And when they get very acidic, time comes when the brain says, okay, we have to clean this place a little bit. So it forces the forced hydration that we call inflammation, inflames the gums to detoxify them. Of course, this gets reddish and sensitive to cold and touch, and you go to tooth mechanic, and what he says, well, he gives you painkillers and he gives you anti-inflammatories. He basically stops the body's attempt to better itself. And from there on, problems increase. Whenever you have a little problem on the teeth, there is a big chance, especially if you have inflammation going on, there is a big chance that bacteria can seep in and they start living on the root of your teeth. Since we are carboholics, we don't produce GC-MAF, or not enough of it. And these colonies of bacteria don't get marked. So our macrophage is not attacking them. They pass by, "Hi brother, how you doing?" and just goes because it's not marked for destruction. No GC-MAF. And this is what I have noticed with my protocol, with Self-Healers protocol, that at the beginning when I start implementing it, a lot of my clients, many of them, I never had a lot of clients, but let's say out of 10 clients, I will have 4 or 3 or 4 coming down with tooth abscesses. Just about a month and a half after they started the protocol. So I was puzzled. Wow, the tooth is okay, but there's abscess right above it. And now you go to tooth mechanic, and tooth mechanic will do what we are told in the school. When you have abscess is always encapsulated, which means that you can drink as much antibiotic as you want, it will not penetrate. So you have to go in. Now, dentists are being told, don't cut it open in a mouth, because all this toxicity will spill out, pollute the whole mouth. You drill the tooth, get to the root canal, and through the root canal you inject needle into the abscess. Well, money, money, money. All this is pure nonsense. Okay? Why? Because abscess as it comes, it will go. And you can even use antibiotic on it, but not the way how we are always dealing with it. What I was doing before I discovered what is better than antibiotic, I would take antibiotic, any antibiotic, and open it up, put it in a water that I boiled before. I'll put it in there, shake it to dissolve it, and then put it in the mouth and hold it in the mouth, and then spit it. Treat always things locally. Why to pollute the whole body, destroy everything in a body to make difference on a tooth? You treat it locally, put it in the mouth, it will absorb. And this was working like a charm, and it will basically stop the inflammation. Why? Because it stops hydration. Antibiotic is toxic. This is why antibiotic works. Not because it kills bacteria, but because it stops hydration on cellular level, which means it stops detoxifying process, and it stops even the forced hydration. Because if something is very toxic, then the body that was having inflammation gets ordered, no, this is too toxic, we cannot push this into the cell. And inflammation goes, like becomes anti-inflammatory, antibiotic. This what happens. And this is why we feel better, not because we killed bacteria, but we have stopped further polluting of the blood from our cells, eliminating toxins. This is why we say, oh, there is no cure for virus. But when you have a cold, symptoms of cold, you take antibiotic, the symptoms of cold go away. Why? You didn't kill antibiotic, you didn't kill virus because it doesn't exist. You have stopped flu. You have stopped further pollution of your blood that was coming from your cells. And this way, all the symptoms of infection go away. It's never infection. It is always body's response to toxicity. This is why I have discovered, before I heard about Béchamp, I have discovered that everything we are being told is just baloney. So, if you happen to have abscess, just use colloidal silver. How did I get to colloidal silver? Because as my clients were coming with abscesses all over the place, so I was researching more about why is this happening and how to stop it, because if I put antibiotic, I'm stopping the hydration, so I'm stopping the protocol. This is no. And then I have stumbled upon colloidal silver. Now, through my blogs, I always say that your teacher, your master, is your inner higher self. Whenever you are missing information, and we know the saying, when you are ready, teacher appears. Well, the teacher could be anything, but the only teacher you should trust is your higher self, your intuition, and where it leads you. So when I was researching how to stop these abscesses from growing, how to destroy the bacteria when people are on protocol, I cannot use any toxicity, then I was led to discover a colloidal silver. So I started investigating more about colloidal silver and how it works and why it works, and then what is happening. And I have discovered again that people who are selling colloidal silver, most of them are selling garbage, because they call it ionic silver, which looks like a transparent water. you expose it to the sunlight, nothing happens. You don't have to have it in a dark bottle. Why? Because the particles, when they are smaller than nanoparticle, they do not have all the properties of a silver, and they do not oxidize. If they do not oxidize, they cannot do proper job in a body. So this so-called ionic colloidal silver is pure garbage. Colloidal silver, to be strong and proper, has to be in a size of nanoparticle, which will make the liquid slightly yellow. As the particle gets a little bit larger, the color of the colloidal silver gets darker, until all of a sudden it flips into reddish. The particle is getting too big. But darker it is, the more sensitive to the light becomes, the stronger action becomes. Anyway, so once when I started instructing people, and this is my protocol now, that everybody who starts with the protocol has to also start utilizing nanoparticle colloidal silver twice a day, hold it in a mouth. So this way you destroy the colonies of bacteria that may be there that were not being destroyed by your macrophage because GC-MEF is missing. They are not marked. Once when you start with the protocol and you repair the genetic expression, your genome, and you start producing GC-MEF again, which happens usually about month and a half after you start protocol, depending on person's toxicity when they start, all of a sudden GC-MEF starts being produced, starts marking the place, and your macrophage, your white blood cells, go in action. And they attack it, and if it's colony, they encapsulate the colony to destroy it. And it always brings inflammation. Inflammation brings pain, and you get these bubbles with pain in the mouth. Now, if it happened to you that you have this going on, don't fall for this, what dental mechanic will tell you, to drill the tooth, take out the beautiful, healthy tooth. Cope with the pain a little bit. Take colloidal silver, hold it in the mouth as long during the day as possible. Then swallow it and take another sip. Just hold it, because what happens? Colloidal silver will penetrate and it will destroy the bacteria rapidly. But remember, it's not just the bacteria. The pain is from inflammation. Inflammation is part of hydration and cleansing of the cells, which is not being stopped with colloidal silver. So the pain is going to continue probably the day, and slowly the following day is going to dwindle. Why? Because now the whole tissue is being repaired, cleansed. This is true healing. If you put antibiotic, it just stops the process. So you will have this abscess sitting there, and it may even get, in time, it may even get mineralized, and it becomes hard ball inside of your mouth. This is all, I'm always saying, the way we are told in medical school, doesn't matter, dentist, veterinarian, physician, what we are told, what to do and how to do things, it is just to make problem worse. Not to heal anybody, but just to make problem worse, until you take it to the level that nothing even works on it, and then we gave it a name. It's autoimmune disease. So remember, if you had bad caries and you have root canal, and now your doctor says, oh, it's better, root canals are not good because, breeding ground of bacteria. No, if it's properly done, then after the nerve is taken out, root canal is being filled in. So it's not anymore open hole for bacteria. And then you can put crown on it, and it's important that you start using that tooth. Because if you use it then the mandibular structure, or if it's a jaw, from the constant pressure, the body adjusts and builds bone around it to support it. And my tooth is so strong that the doctor could not, the dentist could not believe that, he'd asked me a couple times, because on x-ray it shows that it's missing nerve, that it's not hollow, that it's filled in. But the bone around it, everything is very strong and very healthy. It's way better to have your own root than having some metal stud put into your bone. Because again, if you are not going to be using that tooth, then it will get loose, because the bone is going to get loose, body will take out what it doesn't want, what it doesn't need. And there's so many people who have this done and then they have problems and all is moving and costs thousands and thousands of dollars wasted. And dental mechanics are getting richer and richer and richer, and they don't give a damn thing about you and your mouth. Because if they do, they would not do this nonsense. But again, they are all following the medical brochures, the new thing which are happening. Wow, yeah, this is a great thing. Actually, we can rebuild, we can regrow our teeth. It just takes frequency to activate stem cell to start producing tooth. Any stem cell in your body can do it, because stem cell is not defined mother cell, and it's in the blood, it goes through the body. If it stops in a place of missing tooth, now it's in environment that has vibration of tooth, and it can be triggered into start producing a new tooth. Especially now we have discovered there are frequencies that you apply to the place to amplify the frequency that's necessary, and the stem cell will immediately trigger and start growing a new tooth. I've heard in Canada they are doing it. Again, every time somebody starts talking about this, they shut him down. So they disappeared. If they disappeared, it means they received bribe and they bought some beautiful house and they are nice and quiet, enjoying their life. They don't give a damn about you. So be a little patient. Soon the Cabal is dealt with. We are just experiencing now further awakening. This is why the Alliance is allowing things to continue, because people, as long as they are comfortable enough, they are not going to do anything about anything. If you have your beer and your recliner and your television, you don't care about anything else. Well, they have to lose the beer and the recliner and the TV so they wake up to this new reality. This is all about waking up. It's not about destroying a cabal. It is not about destroying the political system or banking system. It is about awakening. And until enough people awaken, this is going to continue. And things are going progressively get worse just because people are not awakening. They need something stronger to hit them in the face before they start saying, oh, shit, what happened? So, another thing that is very common, as you get older, your gums start receding. Of course, you go to tooth mechanic, and the action is going to be, well, we'll put a little bit epoxy on them. But dentin, where dentin starts showing, just put a little bit face on it, and no problem. So your teeth look a little bigger, but at least they are bright and shiny. Well, we don't have to do this. because usually stuff starts sticking to these places because it's never as polished and as clean edge as it is in normal tooth. Why do we have receding gums? Because of cellular dehydration. As when cell is well hydrated, is round and pressurized, as it loses plasma, it deflates. As it deflates, it gets smaller. So if a tissue is getting smaller and gums are tissue, it starts receding. Hydrate. And you will stop the receding and you will actually expand again, repair your receding gum. So we have to learn the truth. We don't need any tooth mechanic, we don't need any doctor. We would not need even surgeons if we would be a little bit more advanced and know the truth. Okay, but for now, at least surgeons are beneficial. They do some stuff until we learn some more truth about manifesting, which will be again soon. We are on the way. We now understand how things work. Now we just have to overcome the brainwashed programming so we can free our mind and fly like a bird. The best thing you can do for your mouth at this point, first, stop eating the forbidden fruit. Stop eating starches. So this way, nothing sticks to your mouth. Eat correctly. You will not have any problem with teeth. Avoid harmful drinks. All these soda pops, all this sweet garbage is very, very toxic for your teeth. It just, especially Coca-Cola, just drills into the enamel of a tooth. Stop with that stuff. And maintain your health of your mouth by using colloidal silver. Sip. One sip. Once a day is enough. If you have more problems, if you have a bridge inserted in, or like me, if you have crowns, twice a day. In the morning, after you had your breakfast, when you're ready to go out, just take. Before I travel with motorcycle, the roads are so bad that I cannot even have, I love crotch rockets. But here, only motocross works. So, before I go out, I take a sip, I put my helmet on, and I hold the colloidal silver until I have to talk, which sometimes is half hour. I hold it and it absorbs. Does a great job. And at night before going to bed. I do after brush, if I brush the teeth, often I don't even brush, I just put colloidal silver. But I use dental floss after I eat because of my craters, I have to get the stuff out. Very easy to take care of your mouth. The disease comes from within, due to starches and due to poor hydration, lack of minerals, and lack of water. Again, when I always try to avoid saying protocol is cure for all diseases, because diseases don't exist. And protocol is basically made for two purposes. First is one to hydrate and cleanse your extra and intracellular liquids, which means blood, plasma, lymph, and your cells. And the other part of protocol is to return your genetic expression where it should be, which can only be done with total absence of traces of dietary carbohydrate. And under dietary carbohydrate, I mean cooked or processed vegetable, especially starchy vegetable, which immediately puts veganism and vegetarianism out the window. Okay, I think that I have covered the basic problems with the tea that we have. Now, yes, people always ask, well, I have a mercury, can I do the protocol? I have amalgam fillings. Well, mercury is leaking from amalgam fillings, but you will be able to cleanse it out. So it is not necessary to take amalgam fillings out and you are going to recover your health. But some people feel great benefits after they have amalgam fillings taken out. I did not have any problem. I had tons of amalgam fillings and I never had a problem because I spent a lot of time diving, free diving, and absorbing seawater, absorbing plasma through the skin, and then cleaning my body. So I had no problem with my fillings. I didn't have any diseases to talk about. It's after I have stopped diving, after I have stopped absorbing, and I continued heavy drinking, alcohol, then the whole hell broke loose. Very quickly I started deteriorating. And this is when I went into deeper research and discovered what I am now preaching. So don't worry about your teeth. Try eat as healthy as possible. Use colloidal silver. There is nothing better than colloidal silver. Completely safe, not toxic. Forget about the Blue Men that you see on internet. It's all advertising. I'm drinking this for about 20 years. I'm drinking colloidal silver. So far I'm not blue yet. It doesn't happen unless you maybe bathe in it, I don't know. You have to have tremendous amount of it before you are going to be rejecting or cleansing it out through your skin. And even that is not going to happen because there are first kidneys and then the mucosal tissue that will take out the liquids. Skin is the last one, and they're extremely toxic. Once when you cleanse a little bit, you are not going to be cleansing anymore through the skin. That's emergency cleansing. You will be cleansing through your kidneys and partially also through your intestines or lungs. So don't worry about it. Colloidal silver is great, and make it yourself. Don't buy it. It's so cheap to make and so simple. But make it yourself. I think I'm describing even the way how it's cheap to make it on in one of my articles. So do it. This is as much as I think we have to know about dental health. If there's any other particular question, please let me know, and if I know the answer, I'll be glad to explain it. Okay, my friends? Love you all. Stick, hold the line. We are winning.